Do you know what EVV stands for? It stands for Electronic Visit Verification. You know what is it? Just like the name says, it's a way to verify a visit has taken place electronically. Electronic Visit Verification. Who was behind it? Obamacare. What's the reason for it? To prevent people from claiming they have provided services to a client when they are 200 miles away. It saves a lot of money for the government from fraudsters, and it also prevents fraudsters from getting paid for services they haven't provided. It also saves agency owners from going to prison for billing services that the employee have not actually provided. Even if that employee has committed the fraud, the company is ultimately responsible for that, for ensuring that the employee did actually provide the services and the client did actually receive the services. So the way the government is going to combat this the fraud is the electronic visit verification. Every agency who bills Medicaid and Medicare and works for a client at home care services at their place of residency must use electronic visit verification for its workers. Okay? So the way that is accomplished is workers log in into a software, an app, to do the timesheet, and that app does not turn on unless you are at the client place of residency that's on file. And if that is not an option, then you can use something called telephony. Some softwares incorporate telephony into their program, so that way you can call from a phone number that is at the client's house and basically proving that you are there at the start of the visit. At the same time, when you're also logging out, the software is tracking where you are at the time that you're clocking out of the shift. So the software will track that you clock in time, your clock out time. It also tracks who you are, the caregiver, who's receiving the service, the client, what service you're providing, the tasks. The tasks may not be required, I don't know. But that's what that is. Electronic visit verification to combat fraudsters from claiming to have provided services when they are 200 miles away from where the client is at the time they have reported that they work. It's the law. Even if your state is not currently asking you to submit visits compliant with EVV, it's coming. So how does the state forces you to do this? Well, as a provider, if you submit a visit that does not comply with EVV, your claims will be denied. Straightforward, right? It is as if you didn't work. It don't matter. So you basically now have to force your workers to use EVV, or you will not be getting paid. Some states are still behind, but the last straw of the requirement was for home health agency, which was 2023. The PCAs and other providers, other home and community-based service providers, have already had to meet this requirement last year. The home health agencies, I think, had to meet in 2023. For some reason, some states are still still keep requesting extensions from CMS. Center for Medicare and Medicaid is the mother and the father of enforcing that regulation. just as is for many regulations. So if you state have an extension or they're in the testing period and you're not being forced, don't wait until the last minute. Figure out how you're going to meet that requirement. Softia, our software, has been approved, is an approved vendor for alternative EVV. And in the next video, I'm going to talk about why alternative EVV vendor is better than EVV itself. In the next video, I'm going to talk about why alternative EVV vendor is better than EVV alone that's provided.